Welcome everybody to our spinal workshop. I'm your host, Dr. Ryan Weaver here at Apex Spine & Performance. Today, we're going to be talking about one of the most common injuries that I've seen in my office in dealing with sports injuries, and one of the most common things that happens to really all of us that we really don't put too much thought into, and that's actually ankle sprains. Now, I know most of the time you think of a chiropractor as just relating to the spine, but shoulders, wrists, ankles, elbows, the extremities of the body are something I have a little further education in from following my mentor in some of our schooling and residency and traveling the country with him and some elite athletes. So, talking about sprained ankles is going to be the majority of the conversation today of how it happens, how we can treat that, and what does a chiropractor do to help the recovery process. And the first thing that we're going to discuss is, again, why we do these spinal workshops is to you viewers out there is to educate you on health in general, specific health topics from nutrition to athletic performance to when you do have injuries to other diagnoses such as fibromyalgia, headaches, low back pain, and even some of the medications and side effects such as we did a few weeks ago with things like ibuprofen and Tylenol. So again, every Tuesday, make sure you tune in. We try to keep these talks anywhere from 10 to 15 minutes. Again, they're on our Facebook page and our YouTube page. So be sure to like our pages there so you get notified when we post things. But let's get started into this. So sprained ankles, the first thing that I always have to say is understanding what a sprain is. And the easiest demonstration I have is if you take two bones that are connected by the ligament, and if you look at the definition of a sprain, now obviously there are different grades to that. I'm not talking about tears, but is overstretching of the ligament. So again, two bones connected by that ligament. If there's overstretching, by default, the bones had to shift in some way. We in our office and as chiropractors, we call those subluxations. There's a change in the normal anatomy and normal anatomic position of those bones. So, treatment for that. Well, obviously we can adjust that, and now there's a process that we go through that of, number one, we want to make sure there's no ankle fracture, okay? And the most common ankle sprain is an inversion sprain where the foot rolls inward versus outward, which is an eversion sprain, and a lot of times you see fractures to the fibula with that. So most of the time we're going to be referring to a inversion ankle sprain. So knowing that is ruling out that there's a fracture. Obviously, if there's a lot of other exam findings that may show signs of a tear, then we have to do further possible imaging there. But really the biggest thing is restoring the proper joint alignment. And that's what we see in some of the most recent and beneficial outcomes to the patient, but from research is restoring the proper normal alignment to allow blood flow and nerve flow to help heal that injury. So again, we want to rule out that there's an ankle fracture or any tears, and then from that point, and sometimes it is very black and blue, but we still are able to adjust that joint. And instead of normal recovery time being from anywhere from 6 to 12 weeks, we have seen athletes recover in as short as 7 to 10 days. So again, avoiding immobilization, which oftentimes you see that with a lot of boots. At times, can that be necessary? Sure. Again, just because you see somebody wearing a boot doesn't necessarily mean it's an ankle sprain. If they have a fracture or any other ligament injury, that is a possibility. But we want to make sure that we can restore that joint to its normal alignment to allow the body to heal itself, which is, again, what we believe chiropractic care can do. So, again, knowing that, coming into our fall seasons with soccer, cross country, and football, we see that a lot. Again, even into the winter sports, we see that as well. And that's really where we see ankle sprains happen in sporting events. But you heard me reference earlier, how about just our everyday average Joe? How often do you walk down a sidewalk or walk somewhere and you may just roll your ankle? Again, that's just a little pebble that can create a bigger injury long term. And what we see happen there is we can even relate that into knee injuries, hip injuries, even into your lower back. Because again, The way that we analyze this in our spine and our body is really from the ground up. So whatever happens with our foundation, which is our feet and our ankles, affects the rest of our spine. Another fun fact there is just in our socks, there are 26 bones in each foot. And if you think about that, that is 25% of our entire skeleton is right there. So our feet and our ankles are very, very, very important to us. But again, how often do we think of going to a chiropractor to see how are the joint alignments? Do we have flat feet? Have we had a history of rolled ankles? And that's something that I always ask our patients, especially our new patients when they come in, is, have you ever had any sprained ankles before? Again, most people don't know what you just learned. So that's why with Spinal workshops, we continue to put this information out to you so that coming up in this upcoming fall season, if you have kids or teenagers or nieces and nephews, your sons, your daughters, if that happens, again, definitely think of having a chiropractor check that. It's something that we deal with on a regular basis. So again, I want to take a few moments to share that with you because it happens a lot more often than you think. I myself, when I played sports in high school, I can think of one really, really, really bad ankle sprain that I had. Again, I didn't know that a chiropractor could check that. But also, in all my years of sports, I've rolled ankles many tens and, however many times, a lot, but none of them were ever really that bad other than the one that I'm referencing where I actually had to be on crutches. So again, I want to share this with you. It's a common thing. Chiropractic care can help. Don't always think of just immobilizing that in a boot. There's other things and research that proves, again, allowing that joint to be back in its normal alignment and allow the body to heal itself, and how fast we can recover from that. Because even as coaches, or if I'm talking to athletes directly, you want to get back safely healthy as quick as possible so you can play the sports that you love. But again, for most of us, that's just normal everyday life. We want to be able to function. So I appreciate you guys tuning into this. I hope this was informative for you, and how shoulder injuries, ankle injuries, elbow injuries, wrist injuries, extremities can be evaluated and checked by your chiropractor. So again, I urge you, in putting a preventative measure to this is always think ahead. It's great to be established here in our office so that if these things happen, you're already under care. We see that a lot with our student athletes, is how fast we can get them back to the game, back to the field or the court, but most importantly, back safely and healthy. So thank you for tuning in, and we'll look forward to seeing you next time.